Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This is the third episode in our series on Myeloproliferative Neoplasms, or MPNs. Multidisciplinary coordination makes it possible for care providers to closely monitor the patient's journey and reduce the risk of developing more aggressive diseases. Today's guests explain their approach to improving care coordination and its impact on patient care and outcomes for patients with MPNs. Our guests today join us from the Moffit Cancer Center in Tampa, Florida. They are Dr. Andrew Kuykendall. He is an assistant member in the Department of Malignant Hematology. And Katherine Mast, a registered nurse. Thank you both for joining me today. Dr. Kuykendall, what strategies has your team used to make the multidisciplinary team more effective?
So I think one of the first things that we did a few years ago was we tried to increase engagement within this multidisciplinary team. We knew that there was a lot of folks that were involved, clinical trial coordinators, nurses, myself, transplant physicians, even our basic scientists that do research on these diseases that aren't necessarily seeing patients. We have a lot of nurse practitioners and PAs that are seeing these patients and involved heavily in their care. And one of the things we decided to do was create this kind of core group, what we call the MPN core at our center, and have monthly meetings where we review education, we review new trials, we review our current trials, we review papers that are published, we talk about challenging cases. We give a time for everyone who's part of that group to then ask questions and bring up any issues that they've seen within the care of these patients that we can improve upon. What that's done is it's actually created connections between trial coordinators and basic scientists and transplant specialists and nurse practitioners who maybe didn't talk necessarily, right? They weren't necessarily aware that the other person was doing this work. And now we've created that bit of engagement and those connections that then pay off, because then they're able to answer questions more easily. They're able to talk directly and be able to kind of navigate the system and make things much more efficient. I think the way that we ultimately judge whether or not that's effective is whether or not patients keep coming back to see us, whether we get increased referrals. Every year we kind of look at the patients that come in. And one of the striking things we've seen over the last 2 years is while our new patient volumes for myeloproliferative neoplasms kind of steadily have increased, as one would expect as we build up this program and bring more trials, the established patients have skyrocketed. So we're seeing our established patients much more frequently and more often. And to me, what that says is people aren't coming to get that one-time opinion. They're coming back for the care that's provided. And I think that's really a testament to nothing that I'm doing and nothing that that the physicians are doing, but it's that comprehensive care team that's able to make patients feel at home and cared for.
Ms. Mast, what makes treating patients with MPNs different from treating other cancers?
Yeah. So the MPNs are unique because they oftentimes will live with their disease for very, very, very long periods of time. Oftentimes they'll live a normal life expectancy. It does depend on the specifics of their disease. Everybody's disease is a little bit different. But I think where we can make some of the biggest impacts is having people on our team that really understand what it's like to have an MPN, because we see that group of patients constantly. Having one person that they can come to is wonderful, but having multiple people that are on their team that they know that are there to help, there to answer their questions, I think that can be really profoundly impactful, especially if, they have a rare disease and their, local hematologist, oncologist may not know a whole lot about it. We actually get a lot of referrals kind of for that reason from outside providers, outside cancer doctors or oncologists that, feel that their patients would benefit from seeing a specialist, just to have a specialist on their team.
Ms. Mast, how important is it to have integrated, coordinated care?
So I think that, as a nurse, I oftentimes I find it really important to understand everything that's going on and have a checklist of everything that this patient needs in order to get squared away and good to go. But I think that just, again, collaboration, being on the same page as your team members, will help you to better understand what's going on so that you can really just better be there for those patients. Because sometimes I'll get phone calls, for example, where they're like, I got a million phone calls. I don't know what to do. I don't know what you guys need from me. And so I do a lot of helping to kind of break down, okay, what's going on here? Did we get our medication? Did we get scheduled for these appointments? Did we carry out everything that was ordered? And I think that, having those lines of open communication with your team members too, so that you can, further delegate, hey, for example, this patient could benefit from a call from a pharmacist to talk about drug side effects, or this patient could benefit from a social work consult to talk about coping a little bit better.
Dr. Kuykendall, how does your team prioritize shared decision-making?
Yeah, I mean, when we talk about shared decision making, I think we can talk about in the sense of sharing that decision with the patients and also sharing it with the entire group, right? And so, oftentimes patients will, the disease does not read the textbook. The disease does not know what's convenient. And so oftentimes these diseases tend to get worse at the worst times. And patients have to rapidly schedule an appointment to come in and see us. Sometimes they see me, sometimes they see a nurse practitioner. But what we like to do is kind of create that engagement where we're all there together in the room making that decision. Oftentimes, we'll reach out, my nurse will reach out before they come in to talk through what's going on, kind of walk through what potential options she's talked to me about before she talks to them to kind of set the stage. When they do come in, they get their labs done. Perhaps they see the nurse practitioner first, who walks through and gets a more detailed account of how they're feeling and what their goals are. The nurse practitioner will then come find me somewhere, wherever I am. Sometimes it's, in the office, sometimes it's in the clinic, sometimes they'll call me at home, and we'll kind of patch everyone together to then talk through, recount what's going on, refocus what our goals of therapy are, discuss what the different options are, and then put it in the patient's hands and say, of these options, what do you think makes the most sense for what your goals are? And oftentimes there's one that makes more sense to everyone. But if there's two ideas that make equal sense, a lot of times what we say is we can give you the pros and the cons and all the information there. But ultimately, we want this to be something you feel very comfortable with, because it's your life, it's your care, it's your disease.
Thank you, Dr. Kuykendall and Ms. Mast Hageman. Make sure to keep an eye out for the final episode in this series. You can also take a look at the show notes for more information and resources on multidisciplinary coordination and myeloproliferative neoplasms. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.